Welcome to Module 10. Module 10 is the last module in this basic medical terminology course, and we intend to give you the opportunity to revisit some of the terms we've covered to date. This module will give you the opportunity to revisit some terms, revise these terms, and hopefully remember the terms before you do your final quiz. Let's get cracking. We are going to look at terms associated with fluid. So the word oedema can be used in many areas in medicine. It means fluid. Our first example, pulmonary oedema, and pulmonary was lungs, so pulmonary oedema is fluid on the lungs. This may occur if you have heart failure and you're going to build up of fluid on your lungs. Sacral oedema we know is fluid. Sacral relates to the sacrum, the lower part of your spine. So this would be a fluid swelling of the sacrum. Another term for fluid, effusion. Pleural effusion is therefore fluid in the pleural membranes, which were the membranes surrounding the lungs. Pericardial effusion, that would be fluid relating to around the heart, or fluid around the heart in the pericardium. Otitis media with effusion. Well, otitis media was inflammation of the middle ear, ot being your ear, media being middle. So here we have inflammation with fluid of the middle ear. Hydro is a prefix meaning water. A hydrocele would be a swelling containing fluid. It's a swelling containing water in the testes. It's not pure water though. Hydronephrosis. Let's break it down. Hydro, break, nephra, break, osis. Osis is our condition. So I have a condition of water, hydro, on the kidneys. Perhaps there's a blockage in my ureter, so the urine my kidneys produce cannot fall down into the bladder. Therefore you get a backlog of the urine, and it would make the kidneys all swollen up with the urine that cannot get into the bladder, and this will cause damage. Our next revision slide, clots and blockages. An embolism is a travelling clot. PE is the abbreviation for a pulmonary embolism. So this would be a travelling clot that has landed in the lungs. A thrombus is a stationary clot. So you've probably heard the term DVT, deep vein thrombosis. That would be a blood clot deep in a vein, but it's stationary. Thromboembolism, we can break it down. Thrombo, break, embolism. So that would be a stationary clot that then starts travelling. A thrombosis, osis is our condition, thromb is the blood clot, so I have a blood clot condition or a condition of having a blood clot. Occlusion means blockage. I could have coronary artery occlusion. Coronary relates to the heart arteries, so I'd have a blocked heart artery. Constriction means narrowing. Bronchoconstriction, that would be narrowing of the bronchial tubes, and they were the tubes leading into your lungs. Stricture and stenosis both mean narrowing. I may have a urethral stricture, so that would be a narrowing of my urethra, the tube that takes the urine from the bladder to the outside world. Sclerosis, hardening. Tympanosclerosis. Tympan was your eardrum. Tympanosclerosis would be hardening of the eardrum. Therefore your eardrum would not wobble very well because it's all hard, and this would affect your hearing. Atherosclerosis. Athero related to atheroma, and atheroma meant the fat in the arteries. Therefore atherosclerosis, hardening of fat in the arteries. You may remember the term atheroma. I described it as porridge. So if you squeezed it out of an artery, that's exactly what it would look like. Special terms are used to describe different sections of the body, or parts of the body in relation to other parts of the body. Let's look at these again. Distal was the point furthest from the point of origin. If we look at the diagram here of the femur, we have the head of the femur, which is the closest part to the origin, and down here, the distal femur. So it's the point furthest away. So that would be the distal femur. Medial and media relate to the middle or the midline. Therefore, the medial side of this femur is here, because we are looking at the front view. Proximal means the point closest to the point of origin. So the proximal femur is the top end up here. Lateral is side, bilateral is both sides. When you're talking about positions of the body, the lateral side would be the outer side of your leg. Anterior is the front, so this is an anterior view of the right femur, or I could have an anterior heart attack, a heart attack on the front side of my heart, an anterior MI. Posterior, back. Let's look at some terms. The distal aorta. Your aorta is the main blood vessel coming out of your heart and travels down through the middle of your body through the abdomen. So the distal aorta is the bit furthest away from the heart. Medial malleolus, or malleolus, you may remember, was the term for your ankle. So your medial malleolus is the bit on the inside of your ankle, the knobbly bit on the inside. Proximal aorta would be the point nearest the top of the aorta. Lateral malleolus is the side of the ankle, so it would be the outside, so the knobbly bit on the outside of your ankle. Bilateral is both sides. A man may have a bilateral orchidectomy, removal of the testes on both sides. Anterior is front. The patient may have an anterior MI. MI means myocardial infarction, which is the heart attack, and the point of the heart attack is at the front of the heart. Posterior is back, so therefore a posterior MI would be a heart attack on the back side of the heart. I've called this slide lumps and bumps. Let's start off with a polyp. A polyp, you may remember, is a protruding growth. You may hear the term dysplasia of a polyp. Plasia means formation or growth, so I'd have disordered formation of a polyp. You can have polyps in many places in the body. You can find polyps in the colon. You have nasal polyps, cervical polyps, the neck of the womb. They're just a protruding growth, and you can have a polypectomy to remove them. Benign means non-invasive, not cancerous, harmless. Benign prostatic hypertrophy, also called benign prostatic hyperplasia. And what we have here is increased growth of the prostate gland, but it is benign, it's harmless. The man may not think it's harmless because it will cause urinary retention. He will find it difficult to pass urine. Malignant means dangerous, invasive. So you could have a malignant tumour, so a cancer that can spread around the body. Another place where malignant is used is malignant hypertension, relating to very high blood pressure. In fact, it's dangerously high, and the patient would be at risk of having a stroke or a heart attack. Metastases is the term for secondary cancer. A patient may have liver metastases, where the cancer has spread to the liver. A prolapse is when something has fallen out of place. You could have a uterine prolapse, where the uterus literally drops down, or you could have a PID L5/S1. This takes us back to orthopaedics, where PID referred to a prolapsed intervertebral disc, the slipped disc, or a bulging disc to be more precise. And it is telling us that the slipped disc, the bulging disc, is between the lumbar 5 vertebrae and the S1, the first sacral vertebrae. A hernia, going back to the term prolapsed and prolapsed disc, sometimes a prolapsed intervertebral disc may be called a herniated disc. It's popped out of place, and a hernia means protrusion. The ending, the suffix "cele," spelt in two different fashions, relates to a protrusion and hernias as well. The term varicocele is a protrusion of varicose veins into the scrotum. Diverticulum. Diverticulum relates to ballooning or pouching, and commonplace for diverticular to occur is in the colon, in the bowel. A patient may have diverticulosis, and that would mean a condition of having ballooning or pouching. The next few terms I've popped on this slide because I feel a lot of them are related to blood flow. So let's start with the term diastole. Diastole was associated with the heartbeat and a particular phase of the heartbeat. And it was the phase of the heartbeat when the heart was generally at rest. The atria do contract and push the blood into the ventricles, but the ventricles are the big, strong chambers in the heart, and they are relaxed, filling up with blood. A term you may come across would be diastolic BP, referring to your diastolic blood pressure. A blood pressure reading would be something like 120/70. The lower number, when the heart is relaxed, is the diastolic blood pressure. Systole is the opposite. It's when the ventricles contract and push the blood out through the aorta and also off to the lungs. The systolic blood pressure is the big number because of all the energy used to contract those ventricles and push out the blood, creating that pressure. So the big number, the 140, in this blood pressure reading is the systolic blood pressure. Ischemia, insufficient blood supply. A classic type of ischemia is angina. Angina creates a suffocating chest pain because of a lack of blood supply to the heart. The abbreviation for ischemic heart disease is IHD, and angina is a type of ischemic heart disease. Infarction. Infarction means death of tissue. A common cause for death of tissue would be a lack of blood supply and therefore no oxygen. If you have a myocardial infarction, you have death of the heart muscle tissue. Myocardial muscle is myocardi, heart. That's a heart attack. Fibrillation. Remember the quivering of the atria, the top chambers of the heart, when they do this, rather than pumping nicely. And that is atrial fibrillation. With atrial fibrillation, also known as AF, the atria are not pumping the blood properly into the ventricles, they just quiver. Consequently, patients with atrial fibrillation may be on medicines such as warfarin, which helps prevent clots from forming. Retrograde means going opposite way to normal. You can actually have a retrograde blood flow. Perhaps there's a blockage or some sort of stenosis and narrowing, and the blood can't get through, so it goes the opposite way to normal. Another term using retrograde is a term a retrograde uterus. In the majority of people, the uterus in a woman actually tilts forward. In some people, the uterus tilts backwards, and that would be called a retrograde uterus. The term cyst means a sac of fluid or a bladder. And if you think about it, a bladder is a sac of fluid. Let's look at some words that use the word cyst, because there are quite a variety. Cystolithiasis. Let's break it down. Cysto, break, lith, break, iasis. Iasis is our condition, lith means stone, and cyst is the bladder. This is a bladder stone condition, i.e. I have a condition of having bladder stone. Cholecystectomy. Chole, break, cyst, break, ectomy. Ectomy is removal of, and cholecyst refers to the gall bladder. A cystoscopy. Break it down. Oscopy is a visual examination with that lighted instrument to look at the bladder. An ovarian cyst. Well, in this case, the cyst is not a bladder. It's more like a spot. Ovarian, we can break down. AN at the end of a word means relating to. So I have a cyst relating to the ovary or a cyst on an ovary. Another term containing cyst would be polycystic ovaries. Break down polycystic. Poly, break, cyst, break, ic. This means relating to many cysts on the ovaries. Our next slide is going to look at the suffixes osis and iasis, meaning condition or disorder. Let's look at our first word. Cholelithiasis. Let's break it down. Chole, break, lith, break, iasis. It means a gallstone condition of having gallstones. Spondylosis. Where's the break? Osis, condition. Spondyle was your vertebrae, your spine. So it's a condition or a disorder of the vertebrae. Endometriosis. Let's break it down. Endo, break, metri, break, osis. Well, endometry refers to the endometrium, and the endometrium is inside the uterus, the lining of the uterus. So endometriosis, a disorder of the lining of the uterus, or a disorder of the endometrium. Thrombosis. Break it down. Osis, condition, thromb, clot. So I have a blood clot, or a condition of having a blood clot. Thyrotoxicosis. Let's break it down. Thyro, break, toxic, break, osis. It's a condition of having a poisonous, toxic, thyroid gland. So my thyroid gland is producing too much thyroxine, that gap and go hormone. Pathy means disease of. Enteropathy, let's break it down. So it's disease of enter. Enter is your intestine. Encephalopathy. Enceph, hello, pathy. The AL in the middle there means relating to. So here we have a disease relating to the brain, or disease of the brain. Adenopathy. Aden, or adeno, is gland. So adenopathy means disease of a gland. Nephropathy. Disease of the kidneys. Cardiomyopathy. Cardio, break, myo, break, pathy. Disease of the heart muscle. Arthropathy. Break it down. Arthro is joint. Pathy, disease. Disease of a joint. So what's this one? Polyarthropathy. Let's put the brakes in. So polyarthropathy will mean disease of many joints. Poly being many. The suffixes plasia, phasia, phagia, and nia, or the P's. Let's look at our first term. Hyperplasia. Let's break it down. Hyper, break, plasia. Hyper means excess, too much. So therefore it's excess growth or excess formation. Aphasia. A, break, phasia. A at the front of a word means no or without. So it means no speaking Or to be more precise, a lack of speech. If you've had a stroke, it doesn't mean you are mute. You will still be able to make some sounds and perhaps some words. There are different levels of aphasia. Aplasia, let's break it down. A is no or without, and plasia is our formation or growth. So it's no formation, no growth. Aphagia. Think G for gulping down your food. Phagia was swallowing. So aphagia is inability to swallow. Rather than saying no swallowing, doesn't sound quite right. Inability to swallow. Dysphasia, or dys at the front of a word means difficulty or disordered. So here I have difficulty speaking. Tachyphasia, tachy at the front of a word means fast. So here I have fast speaking. Bradynia. Let's break it down. Brady, break, nia. A silent P on that one. Brady means slow. So if I have bradynia, I would have slow breathing. If I had tachynia, I'd have fast breathing. Apnea, or A at the front of the word, means no. So here I would have no breathing. An example where apnea is used is in the condition called sleep apnea, when people have moments of not breathing during their sleep and they snore themselves back into breathing. Time to revise the suffixes otomy, ostomy and ectomy. If you remember, otomy is incision and ostomy with that S for staying open is our opening, and ectomy means removal of. Think excision. If you excise something, you take it away. Our first term, thoracotomy. Let's break it down. The meanings are going to come later. I want you to think about them as we go through the list. Ileostomy. Let's break it down. Pericardotomy. Oophorectomy. Laryngotomy. Let's break it down. A laryngectomy. Myringotomy. The big one, dacryocystorhinostomy. I couldn't fit that one on. Hemiglossectomy. Hopefully you thought about where the breaks would go and you've got that correct. You may not be familiar with all the terms, you may have forgotten a couple, but that's fine because you're going to get at least half the word right. Let's see how we go. Thoracotomy was an incision into the chest. Thorax is chest. Ileostomy is an opening, ostomy, into the ileum, part of the small intestine. Pericardotomy is an incision into the pericardium, which is the lining around the heart. Peri, around, card, the heart. Incision in the pericardium. Oophorectomy, removal of an ovary. Oofers are ovary. Laryngotomy, incision into the voice box. Your larynx is your larynx, which is the voice box. Laryngectomy, removal of the voice box, the larynx. Myringotomy, incision into the eardrum. And the big one, dacryocystorhinostomy. Remember, you cry tears, that's your clue. So dacry is tears, cyst is the sac, rhine is nose, ostomy opening. It's an opening between the nose and the tear sac, allowing drainage of the tears. Hemiglossectomy. Hemi is half, gloss is tongue, so it is removal of half the tongue. Just a few more coming up. Emesis is vomit, so hematemesis would be vomiting blood. Centesis, drawing off fluid. Amniocentesis would be drawing off the amniotic fluid which surrounds the unborn baby. A thoracocentesis would be drawing off fluid from the chest cavity. Next we have seal or seal, swelling or protrusion. A proctocele and a rectocele. Both actually refer to the rectum. Proct means rectum and rect means rectum. And what this would mean is a protrusion of the rectum into the vagina. Orage means bursting out of. So menorrhage or menorrhagia would be bursting out of menses, and menses is the term for the period. So this is otherwise a heavy period. So this is otherwise known as a heavy period, menorrhagia. Aurea is discharge or flow. Otorrhea, ot is ear, aurea is our discharge or flow, so we have a discharge from the ear. And at the very beginning of the course we broke down the word diarrhea, which you may remember means through flow. And lastly, we just have some very large words to break down before it's quiz time. Let's see how you go with these. Big words. Our first big word, proctosigmoidectomy. Let's break it down. Procto, sigmoid, ectomy. Proct is rectum, sigmoid related to your sigmoid colon, so it's removal of the sigmoid colon and the rectum. Next word, hemopneumothorax. Let's break it down. Pneumothorax. Hemo is blood. Pneumo means lung or air. In this case it's going to be air. So it's blood and air in the chest cavity. Thromboendarterectomy. Where are the breaks in this one? There they are. Thrombo, end, arter, ectomy. We know that ectomy is removal of. Arter is artery. End is the prefix for inside. And thrombo is our clot. Therefore, it's a removal of a clot inside an artery. Osteochondritis. There's the breaks. Osteo, bone. Chondra, cartilage. Itis, inflammation. Inflammation of the cartilage and bone. Polyneuralgia. We've not had this root term, but let's see if you can guess it. There's our breaks. Algia is pain. Poly is many. So I have pain in many neur. Neur relates to your nerves. Pain in many nerves. Chondroosteodystrophy. Looks scary, but it's not. Break it down. Chondro, break. Osteo, break. Dys, break. Trophy. Trophy means nourishment or growth, and in some instances we looked at it in terms of size. Dys is difficult or disordered, oste is bone, chondra is cartilage, so I have disordered growth of bones and cartilage. hepatosplenomegaly. Put the brakes in. Megaly, enlarged. It's an enlarged spleen and liver. Enlarged liver and spleen. And lastly, polymyalgia. Let's put the brakes in. Poly, break, my, break, algia. Algia is pain. My is muscles. Poly, many. Pain in many muscles. It's quiz time. If you're ready to complete your final quiz, do go to the left and click on the quizzes. If not, do go back and revise, and when you're ready, go to your final quiz. On this note, I would like to say thank you very much for completing our basic medical terminology course. Do take the opportunity to practice as much as you can. That's what will make it stick. Thank you very much.